Question 121. Which of the following treatments is used for rectal cancer but not for colon cancer? A. Chemotherapy. B. Colonoscopy. C. Radiation. D. Surgical resection. Question 121. Answer: C. Radiation. Question 121. Explanation: a client with rectal cancer can expect to have radiation therapy in addition to chemotherapy and surgical resection of the tumor. A colonoscopy is performed to diagnose the disease. Radiation therapy isn't usually indicated in colon cancer. Question 122. Which of the following conditions is most likely to directly cause peritonitis? A. Cholelithiasis. B. Gastritis. C. Perforated ulcer. D. Incarcerated hernia. Question 122. Answer: C. Perforated ulcer. Question 122. Explanation: the most common cause of peritonitis is a perforated ulcer, which can pour contaminates into the peritoneal cavity, causing inflammation and infection within the cavity. The other conditions don't by themselves cause peritonitis. However, if cholelithiasis leads to rupture of the gallbladder, gastritis leads to erosion of the stomach wall, or an incarcerated hernia leads to rupture of the intestines, peritonitis may develop. Question 123. Which of the following symptoms would a client in the early stages of peritonitis exhibit? A. Abdominal distension. B. Abdominal pain and rigidity. C. Hyperactive bowel sounds. D. Right upper quadrant pain. Question 123. Answer: B. Abdominal pain and rigidity. Question 123. Explanation: abdominal pain causing rigidity of the abdominal muscles is characteristic of peritonitis. Abdominal distension may occur as a late sign but not early on. Bowel sounds may be normal or decreased but not increased. Right upper quadrant pain is characteristic of cholecystitis or hepatitis. Question 124. Which of the following laboratory results would be expected in a client with peritonitis? A. Partial thromboplastin time above 100 seconds. B. Hemoglobin level below 10 mg/dl. C. Potassium level above 5.5 mg/L. D. White blood cell count above 15,000. Question 124. Answer: D. White blood cell count above 15,000. Question 124. Explanation: because of infection, the client's WBC count will be elevated. A hemoglobin level below 10 mg/dl may occur from hemorrhage. A PT time longer than 100 seconds may suggest disseminated intravascular coagulation, a serious complication of septic shock. A potassium level above 5.5 mg/L may indicate renal failure. Question 125. Which of the following therapies is not included in the medical management of a client with peritonitis? A. Broad-spectrum antibiotics. B. Electrolyte replacement. C. IV fluids. D. Regular diet. Question 125. Answer: D. Regular diet. Question 125. Explanation: the client with peritonitis usually isn't allowed anything orally until the source of peritonitis is confirmed and treated. The client also requires broad-spectrum antibiotics to combat the infection. IV fluids are given to maintain hydration and hemodynamic stability and to replace electrolytes. Question 126. Which of the following aspects is the priority focus of nursing management for a client with peritonitis? A. Fluid and electrolyte balance. B. Gastric irrigation. C. Pain management. D. Psychosocial issues. Question 126. Answer: a fluid and electrolyte balance. Question 126. Explanation: peritonitis can advance to shock and circulatory failure, so fluid and electrolyte balance is the priority focus of nursing management. Gastric irrigation may be needed periodically to ensure patency of the nasogastric tube. Although pain management is important for comfort and psychosocial care will address concerns such as anxiety, focusing on fluid and electrolyte imbalance will maintain hemodynamic stability. Question 127. A client with irritable bowel syndrome is being prepared for discharge. Which of the following meal plan should the nurse give the client? A. Low fiber, low fat. B. High fiber, low fat. C. Low fiber, high fat. D. High fiber, high fat. Question 127. Answer: B. High fiber, low fat. Question 127. Explanation: the client with irritable bowel syndrome needs to be on a diet that contains at least 25 grams of fiber per day. Fatty foods are to be avoided because they may precipitate symptoms. Question 128. A client presents to the emergency room, reporting that he has been vomiting every 30 to 40 minutes for the past 8 hours. Frequent vomiting puts him at risk for which of the following? A. Metabolic acidosis with hyperkalemia. B. Metabolic acidosis with hypokalemia. C. Metabolic alkalosis with hyperkalemia. D. Metabolic alkalosis with hypokalemia. Question 128. Answer: D. Metabolic alkalosis with hypokalemia. Question 128. Explanation: gastric acid contains large amounts of potassium, chloride, and hydrogen ions. Excessive loss of these substances, such as from vomiting, can lead to metabolic alkalosis and hypokalemia. Question 129. 5 days after undergoing surgery, a client develops a small bowel obstruction. A Miller-Abbott tube is inserted for bowel decompression. Which nursing diagnosis takes priority? A. Imbalanced nutrition, less than body requirements. B. Acute pain. C. Deficient fluid volume. D. Excess fluid volume. Question 129. Answer: C. Deficient fluid volume. Question 129. Explanation: fluid shifts to the site of the bowel obstruction, causing a fluid deficit in the intravascular spaces. If the obstruction isn't resolved immediately, the client may experience an imbalanced nutritional status, less than body requirements. However, deficient fluid volume takes priority. The client may also experience pain, but that nursing diagnosis is also of lower priority than deficient fluid volume. Question 130. When teaching an elderly client how to prevent constipation, which of the following instructions should the nurse include? A. Drink 6 glasses of fluid each day. B. Avoid grain products and nuts. C. Add at least 4 grams of bran to your cereal each morning. D. Be sure to get regular exercise. Question 130. Answer: D. Be sure to get regular exercise. Question 130. Explanation: exercise helps prevent constipation. Fluids and dietary fiber promote normal bowel function. The client should drink 8 to 10 glasses of fluid each day. Although adding bran to cereal helps prevent constipation by increasing dietary fiber, the client should start with a small amount and gradually increase the amount as tolerated to a maximum of 2 grams a day.